Hi guys, and welcome back to the Caribbean Spot. In today's video, we examine the Trump's administration visa restriction for islands doing business with Cuba. Let's get into this video. The Caribbean is at a crossroads. The U.S. government, led by Secretary of State Marco Rubio, has introduced visa restrictions targeting officials from Caribbean nations that work with Cuba's medical program. This decision forces leaders in Grenada, Barbados, Jamaica, and beyond to make a tough choice: safeguard their healthcare system or comply with U.S. demands to avoid visa ban. But what does this really mean for the region? And how will this impact thousands of Cuban doctors serving across the Caribbean? Let's break it down. Who will be affected by the U.S. visa restrictions? The U.S. restrictions will impact Caribbean government officials working with Cuban medical programs, policymakers responsible for hiring Cuban doctors, health ministers and diplomats, even their immediate family members, risking visa cancellation. This puts immense political pressure on Caribbean governments. Do they choose medical access or diplomatic survival? Cuba's internationally recognized medical assistance has been a lifeline for many Caribbean nations, including Grenada, Barbados, Jamaica, St. Vincent and the Grenadines, St. Lucia, Antigua and Barbuda, Dominica. For decades, Cuban doctors, nurses, and specialists have filled major healthcare gaps across these islands. But what happens if they're forced to leave? There's a few reasons how Cuban doctors benefit the Caribbean. One, they provide us with affordable healthcare. Cuban doctors provide medical care at a fraction of the cost. Two, specialized medical services. They bring expertise in surgery, pediatrics, and internal medicine where local training is limited, right? Number three, emergency response. Cuban medical teams have been first responders in hurricanes, pandemics, and crises. And lastly, they prevent medical brain drain. We know that many local doctors migrate for better wages. And here we have the Cuban professionals help fill those gaps. But this program isn't without controversy. Here is the dark side of Cuba's medical program. While Cuba's doctors save lives, critics say they pay a hidden price. Cuban doctors sign a strict contract with the Cuban government. They only receive 10 to 25% of their salaries, while Cuba takes 75 to 90% of earnings from host countries. Over 60 countries currently use Cuban medical services. Cuba reportedly earns $8 billion plus US dollars annually from this program. The US calls this forced labor, but Cuba argues it's humanitarian aid. So what should the Caribbean nations do? Hey everyone, I just wanted to take a quick moment to thank you for watching. If you're enjoying this content and want to see more, do me a huge Caribbean favor. Hit that subscribe button, give this video a thumbs up, and drop a comment below. Your support helps me grow this channel and build a strong Caribbean community where we can have real conversations. Let's keep this momentum going. Like, share, comment, subscribe. Now back to my commentary. So what if Caribbean nations cut ties with Cuba? If Caribbean leaders give in to U.S. pressure and cut ties with Cuba's medical program, they face devastating consequences. Soaring healthcare costs. Replacing Cuban doctors means millions in new expenses. Doctor shortages. Many islands can't produce enough doctors fast enough. And decline in public health. Rural and low-income communities will suffer the most. Caribbean leaders must act fast, But what are their options? Caribbean governments can't afford to lose vital healthcare services, but they also don't want diplomatic fallout with the US. So here's what they can do. They can negotiate with the US, seek exceptions to avoid visa restrictions while maintaining healthcare partnerships. They can demand fair pay for Cuban doctors. Caribbean leaders should pressure Cuba for better wages for the doctors, better wage transparency, diversify medical partnerships. Maybe look outside of Cuba. Look to China, India, Venezuela, or even train more local doctors. As of now, the US government has not specified a deadline for Caribbean nations to comply with the newly expanded visa restrictions related to Cuba's medical labor export program. The policy announced by Secretary of State Marco Rubio on February 25th, 2025, immediately targets Cuban officials and their immediate families involved in the program, which the US describes as forced labor. While the policy is already in effect, the US has not publicly outlined a specific time frame for Caribbean nations to alter their participation in Cuba's medical missions. However, given the immediate implementation of visa restrictions on individuals associated with the program, Caribbean governments may face prompt diplomatic and operational challenges. It is crucial for Caribbean nations to engage in diplomatic discussions with U.S. officials to clarify expectations and negotiate terms that consider their healthcare needs and international relations. So, why is Marco Rubio pushing this policy? Rubio and the US claim that Cuba's medical program is exploitative. However, critics argue this is a strategic move to weaken Cuba's economy by cutting off a major revenue source, increase US influence in the Caribbean by limiting ties with Havana, pressure Caribbean nations to align with US policies. So, is this about human rights or power politics? The big question is, what should the Caribbean do? As US pressure mounts, Caribbean nations must decide. What do? Do they keep Cuban doctors and risk diplomatic tensions? Or do they side with the US but face a medical crisis? Or find a middle ground? One thing is clear. This is a defining moment for the Caribbean's healthcare and diplomacy. Okay, guys, so here's my 2 cents on the whole matter. Put aside whatever political, motivated agenda, that the US may have with this whole thing. I want you to see things through a different lens, right? You have medical professionals, doctors, nurses, specialists being deployed into different countries to work, and they are receiving 10 to 20% of their salaries. One report that I read, the lady said she was making 125 US dollars for 6 months. Every month that would be her salary. And then they would give her family 50 US dollars. And then they upped her money a little bit. So I think she went to 150 US dollars a month. Now look at that a little bit and then look at how much Cuba rakes in a year. Over 8 billion US dollars. What are they doing with the money? Why can't they pay their doctors fairly? This could be such a wonderful program if they're not hogging all the money, right? Because I believe in humanitarian efforts. But if you're going to shortchange me and you take all the money, and when I go home, I can't even see the country being developed. I don't know where the money is going, what it's being used for. Like, what are you actually doing? Now I'm feeling that you're exploiting me and you're forcing me to work so that you can get rich because I don't know what you're doing with the money. I'm not seeing evidence of 8 billion US dollars in the country. Where is it going? I'm livid over this. I'm livid over this. And you would be too. If your country sent you to work in a different country and then you're being monitored, you're living in deplorable situations, and then the country decides, hey, I'm only going to give you 10% of the money that I'm being paid. So they give you 125 US dollars to work for a whole month. And they take billions of US dollars. I know Jamaicans will kick up. I know Grenadians would kick up. I know Barbadians and the whole Caribbean islands. They would not stand for something like that. Not at all. So if we would not like that for ourselves, we should not want this for our brothers and sisters in Cuba. They deserve more money. They deserve more pay. It is time for things to change. It is time for us to be our brother's keeper. So I'm calling on the 60 plus countries who are currently hosting the Cuban doctors and nurses to stand together in one accord. Caribbean nations, you guys need to stand together in one accord. All of you have contracts with Cuba right now and you have medical professionals in your countries. You need to stand together right now and let Cuba know enough is enough. We pay you billions of US dollars a year to have your people and your services in our country. But the way you're treating them is inhumane. That's enough. We had enough. If all of you join together and speak with one accord, things will change. Be your brother's keeper. Pressure Cuba to start paying these doctors and nurses fair salaries and stop treating them like if they are property. That is all I have. Leave your thoughts in the comment section. Let me know what you think. Until the next video, bye.